Hi, this is Sharon Coronado and my patient Dan, and we're going to do today an assessment on the respiratory, cardiovascular, and peripheral vascular systems. So I'm going to start first by taking a general look at you. This is going to be the respiratory first. I'm looking first. I see no nasal flaring, no retractions in the chest. His skin is warm and dry. His conjunctiva is nice and pink. Can you put your thumbs together for me? And when I see your thumbs together less than 180 degrees, which is great. Okay, you can relax. Let me just look at your fingers. Good capillary refill when I press on his fingers. And then I'm going to just check his chest, inspect just to see if I see anything on his chest, any masses, growths, any tenderness.
No.
Okay, so I'm going to just go to your back, and I'm going to check for tactile fremitus. And when you do this, you're going to feel my hands on your back, and when you feel them, just say the word 99.
99, 99, 99, 99, 99, 99.
Okay, so when I feel, I hear vibrations and firmness on the top, and as I go down to the bases of the lungs, it's less. And the next thing that I'm going to check for is I'm going to do some percussion on your back. And I would also do percussion on the front as well. But I'm going to have you give yourself a bear hug in the front, and you'll feel me just tapping on your back, okay? I'll start at the apex of the lung, and I'm going to go down. Okay. So when I hear the percussion, I hear nice resonant sounds, and it gets duller as I get to the base, and I'd also do this on the other side as well, and in the front. And the next thing I'm going to do is check your back. I'm going to have right around your mid-spine, your T10 area, I'm going to have you take a nice deep breath and exhale through your mouth.
Am I still bear hugging?
No more bear hugging.
Okay.
So take a nice good deep breath and let it out. Perfect. Okay, good. So when you breathe in and out, I can feel nice symmetrical breathing and everything. So that's good. And now I'm going to check you for your maximum inhalation and exhalation. And when I do this, I'm going to have you first start by exhaling, like breathing in deeply and exhaling, and hold it. Okay, right about there. Okay, you can relax. Okay, now I'm going to have you breathe in deeply and exhale completely. Okay, about there. So then I would just have my little ruler, I measure, and I think, yeah, it's about 4, which is great, 4 centimeters, which is perfect for our maximum inhalation and exhalation. All right, so now we're going to move on to the cardiovascular assessment, and I'm going to have you lie down over here. Okay. Now I'm going to first take a look at his neck. Just turn your head slightly over that way, and I'm just looking to see if I have any, see any jugular vein distension, which I don't. No distension at all, so that's good. And now you're going to just feel me. I'm going to just kind of press around on your chest, and I'm feeling if I feel any masses, pulsations, and I'm also going to feel if I feel any of the pulsations of the heart. I'm just feeling. Okay, I don't feel any masses or anything irregular, no heaves in the chest. And now I'm going to just listen to your chest with my stethoscope. And for my assessment, I have, when I use the bell, it's slight pressure and firm pressure for the diaphragm. So I start by finding my landmark, which is this clavicle, and that's where the first rib is. And I'm going to go to the second intercostal space on the right side, right near the sternum. And when I listen here, I hear S2 sounds. And then I'm going to go to the left side and the second intercostal space that I'm also listening. And I also hear S2 sounds. I'll go down to the third rib. Sorry. Intercostal space. And this is the herbs point. And the herbs point right near the sternum, I'm going to hear both S1 and S2 equally. Fourth space is a tricuspid area named the sternum. And I hear S1 stronger. And then the fifth intercostal space, I'm going to look for the midclavicular line and come down, and this is called the point of maximum impulse. And here I hear S2 sounds, S1 sounds, the strongest. And then I would also listen with my bell to all these areas. And then I'm going to just have you turn slightly to the left side, if you would. And then I'm going to listen right around the left point of maximum impulse, intercostal 5. And I'm listening lightly with the bell, just to hear if I hear any kinds of murmurs, extra heart sounds. And I don't. And then lastly, I'm going to just have you sit forward in a sitting position. Okay. And just lean a little bit forward. And I'm going to just listen to your your second intercostal space again on right and left side with my bell. And I don't hear any extra sounds, murmurs, clicks. Okay, great. So everything sounds normal. I don't hear any extra sounds or murmurs. So now I'm going to check your peripheral vascular system, and I'm going to check with your pulses. I'm going to start first by checking his temporal pulse. And that's a 2+. And turn your head a little bit. I'm just checking the carotid. Hold your breath just for a minute. Okay. 2+ there. And I also can listen with my stethoscope to the carotid just to make sure I don't hear any bruits or thrills. And then I'm going to check your brachial pulse. Just turn your arm over. And I'll just hold it. I'm just checking. Okay, 2+ on the brachial. I'm going to come down to your radial pulse, and that's 2+. And the ulnar side, 2+. Then I would come down further, and I'm going to check his inguinal femoral pulse here, and that was 2+. And then I'd come down behind his knee, check his popliteal pulse, and that's 2+. Come down to his foot, and I'm going to check the dorsalis pedis on the top of the foot, and that's 2+. And then lastly, the posterior tibialis, which is inner ankle area. Okay, and that's 2+ too. And then I can tell, looking, he has equal hair distribution on his extremities, and his skin is warm and dry, and he's got some hair in his big toe. So that ends my exam. Thank you.